Good afternoon and welcome to our daily COVID-19 update for the town of Plymouth. I'm Steve Triffletti, your Plymouth Town Moderator, and during June we're here on Mondays and Thursdays at noon for this update. This forum is being brought to you live by PAC TV on Comcast channels 13 and 15 and Verizon's channels 43 and 47. You can also watch this on PAC TV's streaming channel by going to pactv.org/live. For questions during today's forum, please email plymouthinfo@pactv.org. These forums can be replayed at pactv.org/Plymouth. Today's participants include Ken Tavares, Matt Muratore, and me, and we are joined by Heather Cozby, Plymouth CPA, also Sarah Cloud. She's the Director of Behavioral Health and Social Work. Michelle Bratti, she is the Director of Elder Affairs for the town of Plymouth. Michael Jackman, he is the District Director for Congressman Keating's office. We had a busy weekend this past weekend. We had a town election. And also, I hope that all of you enjoyed Father's Day. I was able to be outside with my grandson, socially distancing. I'm wearing the tie that we both wore yesterday on Father's Day, my first Father's Day with my grandson. I hope everyone had a great day. And at this time, we're going to go to Kenneth Tavares, and he is the chair of the Select Board, at least for today. Ken, welcome.
Steve, good afternoon, everyone. As Steve mentioned, we had the town annual election on Saturday. Mrs. Betty Cavaco was returned to the board, and Mr. Dick Quintal is now joining us. They will be taking their oaths of office publicly tomorrow evening at 5 o'clock via Zoom. Also, I want to keep reminding residents that if you took advantage of the extra time for your taxes, they are due on the 29th, which is this week, coming up. So please, if you did take advantage of the reprieve, and you want to avoid penalties and interest, pay them by the 29th. Also, we have a very full meeting coming up with the Board of Selectmen on Tuesday evening. There are a number of articles in the docket that are very important and will be somewhat time consuming. Thank you, Steve.
Thank you, and that is Kenneth Tavares, and he is the chair of the Plymouth Select Board. At this time, we welcome back Sarah Cloud to our health segment. She's the Director of Behavioral Health and Social Work, Beth Israel Deaconess here in Plymouth. Welcome, Sarah.
Thank you, Steve. Happy Monday, everybody. So I was going to talk a little bit about coping again today. Coping has been a very important survival skill during the pandemic. And many of us have turned to activities that are either distract us or soothe us. So distraction activities could include things like binge watching Netflix, trying new hobbies, or, I don't know, debating politics on social media. Soothing or self-soothing activities may include things like eating, drinking, or maybe a little bit healthier exercising and getting outside. But regardless, coping skills that are effective, particularly in the moment, are all good because they serve their purpose. However, coping skills that have a negative side effect or a negative outcome over time are something that we need to pay attention to and maybe make some adjustments. So drinking alcohol is one of those very popular coping skills I know during the pandemic, especially as the weather gets nicer. I mean, it's legal, it's socially acceptable, it's very, very effective in both soothing and numbing. It's also progressive, so it starts off slow and innocent and just enjoyable and sociable, and before you know it, kind of sneaks up on you. It's also super easy to rationalize. So how many of you said, I've worked really hard today, I'm going to have a glass of wine or some beer with dinner, it helps me relax, I deserve this, I can stop anytime I want to. So I'd like to just encourage everyone to self-monitor for signs, which include hiding or minimizing the amount that you drink. So what that might look like is if you're getting together with friends or family, certainly in a physically distancing safe way, of course, that you might have a drink or two before you get together with them, so that you're not drinking as much in with other people around. Or it might mean kind of hiding the bottles, if you're drinking alone or whatever it might be. It also includes feeling badly in the morning and making that vow that you're going to take a break from drinking, at least for the rest of the day. It includes attempts to cut back the amount that you're drinking. So, what that might look like is I'm only going to drink on the weekends. Well, the weekends now start on Thursday and they run to Sunday, and well, maybe it's the weekends and on special occasions. So it kind of ends up becoming very regular as part of your habit. Another sign is that your family or friends express concern about how much you drink or what you did or how you acted while you drank. Another sign is spending a lot of time either drinking, being sick from drinking, or recovering from hangovers. So when that activities or the effects of it end up taking a lot of your day or a lot of your time and attention, that's another sign that it could be really challenging and something to maybe start to take a look at and do something about. So if you're worried about yourself or a loved one, please know you're not alone. There is hope and there is help. There are several resources available to us in the area. A really popular one is Massachusetts Substance Use Hot Helpline. It's very easy to Google and find. It's an 800 number, which is 800-327-5050. We're also very, very fortunate to have the Plymouth Recovery Center right here in downtown Plymouth. And we have many organizations like Plymouth County Hope that offers recovery navigators. Everything's that I'm mentioning is both free and highly confidential. And most likely are staffed by recovery coaches, recovery navigators. Those are folks that are in long-term recovery, so they really understand what it's like to be in this position of reaching out and getting help. Families are really important to get them connected as well. There's a really great virtual meeting run by Family Restored in the evenings on Tuesdays and Thursdays. And certainly, going into withdrawal symptoms or alcohol it can be a medical event and a medical need. And so our emergency room is here to help if you need as well. So I just wanted to share that public service announcement with everybody today. Thank you.
Thank you. Sarah Cloud is the Director of Behavioral Health and Social Work at Beth Israel Deaconess. She's here to answer your questions. You can email us at plymouthinfo@pactv.org. Each day we date stamp these presentations. This is presentation number 60, coming to you live on June 22nd. We began at 12 noon. And we now welcome back Michael Jackman. He is the District Director for Congressman Bill Keating's office. Welcome, Mike.
Thank you, Steve, and thank you as always to PAC TV for having me on to talk a little bit about what's going on in our office and federally for folks. Just a few quick updates. We are seeing that a lot of the agencies are slowly but surely reopening. I've mentioned before, one of the issues a lot of constituents are having is that they filed their federal tax return on a paper, by paper, mailed it in by the post. They have been waiting for a refund, and I know it's been very frustrating for people. We are getting some notices and indications that some of the service centers nationally are slowly but surely moving from the shutdown phase through phase 1, 2, 3, what have you, of their own process, so that we should be seeing more activity from the service centers over the next couple of weeks in terms of people being able to get their refunds processed and returned to them. A lot going on, obviously, with the economic impact payments, the stimulus checks that the IRS has also been responsible for. There's also been a lot of frustration with that, as I'm sure people listening know or unfortunately have experienced themselves. One thing we have, a little bit of news we have on that is if you go on the portal, the Get My Payment portal online, and it shows that your payment was actually issued, but you didn't receive it, most likely that means that you got a debit card, and the debit card was mistakenly disposed of, thrown out in the mail because it comes in the plain white envelope and kind of a nondescript mailing. But now the IRS is offering to put a trace on individual payments. You can use that Get My Payment portal to request a trace as well. If you have any questions about that, please feel free to call our office here in Plymouth, 508-746-9000. The only other agency I wanted to mention in my initial comments is the Passport Agency, which again, they were largely shut down for the last 2 months. We're only doing emergency passports in life or death situations. If you schedule the flight and it's coming up, that doesn't necessarily qualify as a life or death situation, but we are seeing that a lot of the passport offices and service centers are reopening and folks are able to get their passports. Because people are starting to travel. I mean, it's some places are opening up again. Some places are still not opened up in terms of international travel and allowing flights in and out of the United States. So definitely check with your airline, your travel agent, check with the State Department as well, because they have advisories on what travel is allowed and is not allowed. But if you need a passport and you have a request in, we might be able to help with that as well. So just wanted to pass on a few tidbits about those different agencies. And hopefully if folks have questions or if they want to get in touch with our office directly, we'll be able to help them as best we can. Thank you, Steve.
Thank you. It's Michael Jackman. He is the district director for Congressman Bill Keating's office. He'll be here to answer your questions. Send them to PlymouthInfo@pactv.org. Each day we bring together officials and experts in various areas of concern responding to the coronavirus. And we welcome back once again Heather Cozby. She is a Plymouth CPA. Welcome, Heather.
Thank you, Steve, and thank you, PAC-TV, for having me again. Lots of stuff happened this week. So believe it or not, 6 days ago, the SBA updated their website to have the PPP loan forgiveness application has been updated. They've also come out with an EZ form. So I wanted to just try to high level walk through some of those changes. The application was updated for whether or not your business is going to use the original 8-week loan forgiveness time period or the 24-week loan forgiveness time period. So just to start with, they also made further clarifications that are going to be important to small businesses, particularly those that are S corporations. Number one, there was a question about whether or not a S corporation shareholder could include their health insurance as a part of a qualified expense. And the position is that no, it cannot be included as a part of your PPP money, part of the payroll costs. That's in contrast to the ability to include health insurance for employees. So if you're the owner and the S Corp pays your health insurance is not allowed to be included. So that may affect some people's planning and what they were looking at. The other interesting point, I mean, I'll go into different pieces, but not talked about very well is we know that you can go from to a 5-year loan. That's what part of the law says. What the interpretation I'm reading says, you can only change your loan term if something's not forgiven from 2-year to 5-year by joint agreement with your lender. So it's not an automatic. So if you're in a situation where you think your debt still under these new rules would not be forgiven, you're going to need to talk to your lender to find out on what circumstances would they not allow it to be changed to a 5-year. So that was an interesting point. The new EZ application, I talked about last week the idea of a shortened form as well as what's been on the news. The EZ application is short and more straightforward, but it is not based on the size of your loan. It is based on that you're self-employed and you have no employees. So it's a very narrow group of individuals that can use it. It will make it easier for them, but it's not the broad-based streamlining that was requested by senators. So if you're in that situation, you're going to want to go to sba.gov and use the EZ application. It also isn't really clear how you know if you qualify for it. I had to go and find interpretation from the Journal of Accountancy in order to really understand how this worked. I think SBA is still in the process of updating their website with more interpretations. The other thing that the law did that's now a part of these loan forgiveness applications is it really walked through how do you apply the 24-week rule to owners and payroll cost versus an employee's payroll cost. So if it is an employee, it is going to be 24 weeks of their salary, and it gets capped up to 46,000 and change. So you can end up now having a lot of your employees' payroll qualify for loan forgiveness, which is great, which should make this really simple for most businesses. What they did for owners, they said, no, you can't do that because we don't want any abuse owners taking advantage of this law. And it used to be, it was capped at 15,000 or 8 of 52 weeks. It's now they've said you can do it based on 2.5 months of 100,000. So they've upped the amount that an owner can use in their debt forgiveness calculation to 20,833. So if your business, your income from your business was over 100,000, the cap you can qualify for is $20,833. If your income from your business is under 100,000, it's going to be 2.5 months of your 2019 effective payroll or income from the business. So again, I know I'm going through this quickly, but there's a lot of information. So I'm hoping I'm just giving enough information for you to go and seek how to do this further. The other piece of this is that for businesses that have not obtained loans, there is money available. There's been discussion of extending the date that you could submit an application, but as of today, that date ends June 30. So if you want to get PPP money, as of today, you only have till June 30th to do it. There continues to be discussion in the legislation and senators and congressmen about continuing to adjust these rules for businesses as the reopening process happens. So I expect more changes to continue to come. One summary I received, the other main issue is, will your expenses be considered deductible that you use this money for? And this has been something I talk every time because it's that important for a business to understand what their income is going to be this year. As recent as last week, they're talking about trying to get this bill on the Senate floor. It's Bill 3612 and voted on. It continues to be touted by the senators as something that they want to push through. So I am hoping that that gets done, and that is something you continue to need to watch. The best way to describe this is that if all your loan, you use the payroll to qualify for your forgiveness, and you have $100,000 of payroll and a $100,000 loan, that $100,000 of payroll is not going to be deductible. And that is the problem because it's going to artificially inflate your income. You're going to end up paying a lot of tax because those deductions were not allowed. So that's another major factor that continues to need monitoring and continues to be talked about. So lots of stuff still going on with this. You know, for the rest of the businesses, there are some other payroll credits I've talked about before. Individuals have mostly settled into understanding if they're going to use their RMD, take their money out of their retirement or not, and things like that. So I haven't been getting a lot of questions that way. And the last piece from the state level I saw that was important was the Division of Unemployment. They sent out a nice letter to employers regarding the national level of unemployment fraud. It was a one-page letter. As an employer, you get lots of stuff from the state saying, oh, you have correspondence. You should really go and find this one-page letter. What it does is it tells you what to do, how to see if any of your employees have been affected by this fraud. It tells you to go look at the monetary determinations that have happened on your account. It tells you to go and ask your employee if they submitted it or not. And if your employee did not submit it, it's your employee's responsibility to then go and deal with the fraud because it's under their name as far as somebody trying to collect unemployment. So I wanted to highlight that as a good letter to go and get. I know there's a lot of information coming at you, and there probably will continue to be as we work through the reporting of all of this and getting through the tax returns this year. So that's it for now.
Thank you, Heather Cozby. Heather is a Plymouth CPA. She'll be available to answer questions. We're now going to go to Michelle Bratti. She's the Director of Elder Affairs for the town of Plymouth. Welcome, Michelle.
Hi, Steve. Welcome. Hi, everyone. Happy Monday. Thank you again for having me. Just wanted to talk today. You know, the reality is that coronavirus remains unpredictable, and our community needs to continue to remain patient. It's not easy to do, especially when it seems like we have been in this pandemic for a very long time. While our state is slowly reopening, we are aware of record spikes in other states, and the contrast of this can be unsettling and continues to leave us with more questions than answers. Despite how long it feels that this has been impacting our lives, we have to remind ourselves that this pandemic is still brand new in the world of science, and it will take some time to both understand it and find solutions to treat or eliminate this virus. I have faith that science will win the battle. The million-dollar question, of course, is when. While we cannot control that, we can control how we respond to this pandemic. In this respect, Cal has created a reopening task force in order to control best practices for senior safety and comfort. We do not have an opening date. Despite this, we are striving to implement every recommended safety protocol in an organized and efficient manner so that when we do open our doors, we will do so knowing that we have done everything possible to ensure patron safety. Cal is extremely appreciative of the members of this task force as they are donating their time to us, and this only shows their dedication to the importance of seniors in our community. It is important to remember that while the Center for Active Living's facility doors have been physically closed to the public, we have not been closed in serving our community and your needs. We remain committed to continuing to stay connected to you through outreach, finding resources that you need, helping you navigate systems, connecting you to community programs, providing timely information, providing Meals on Wheels, and our newest program, Grab and Go Lunch. For the latter, please contact Cynthia to register for your meal choice and details regarding this program. I can assure you that when you pull up to get your meal, you will be met with cheers and fanfare from our staff, usually me as well. And we miss you all and are thrilled to get to see your masked faces and you in person. A little bit of contact, seeing each other goes a long way. You need to be aware that when Cal does open its doors, we will look different from when you were here last, as we will be making internal changes that reflect social distancing measures. Programming will start small, and those few that do return will be ones that have the least person-to-person contact. We are working very hard to create virtual and online programming that gives you a hybrid of options to stay active, fit, and most importantly, engaged with others. We are also working with PAC TV and Duxbury COA, Kingston COA, and Pembroke COA to create joint programming that will be shown on PAC TV for those that prefer to watch from their home television. We want to make sure you feel connected one way or another, and I encourage you to consider future programming that actually involves socialization from all three areas. Some in person at Cal when we open, some from Zoom classes, and some from PAC TV shows. We already have Zoom programming that includes mindfulness, yoga, delicious and nutritious, and bingo, with several more coming in the near future. Call us to engage. It's really important. Lastly, on behalf of the Center for Active Living, I would like to extend the utmost gratitude to Eastern Bank's Charitable Foundation for their very generous donation in support of Cal's efforts to help our neighbors in our community during the COVID-19 emergency. This amazing donation of $10,000 will help us continue to serve the needs of our senior population, and we are most grateful for this support. Thank you, Eastern Bank, for making this donation and giving us means to help our seniors through this crisis. Thank you, Steve.
Thank you, Michelle Bratti. She is the Director of Elder Affairs for the town of Plymouth. She'll be here to answer your questions. Please send them to plymouthinfo@pactv.org. And now each day we have a report from our Plymouth State Representative Matthew Muratore. Matt, a lot has happened since last Thursday, and I'm sure you have lots of update information for us. Welcome.
Thank you, Steve. Yes, we sure do, and hope everyone had a great Father's Day and a great weekend. So the numbers that we talk about every show are looking terrific. The number of positive tests that have been happening is now under 2% at 1.9%. And the 7-day weighted average of positive tests is now down 93% since mid-April. So that's terrific news. The 3-day average of patients in the hospital has dropped 73% since mid-April. And we're now down under 1,000 patients that are in the hospital with COVID-19 to 927 as of yesterday. And the ICU is down to 194 patients throughout the Commonwealth. And the average number of hospitals using surge capacity, that's using extra beds for COVID-19, is only down to 2 hospitals now in the Commonwealth, and that's down 90%. And the 3-day average of death is down 86%. So that the amount of deaths from this are slowing down as well. With that said, though, we're approaching almost 8,000 deaths at this point. We're at 7,858. Interesting enough, back in the middle part of April, it was about a 50-50 split of those that have been passing away from it, male and female. Now it's predominantly female. It's 53% versus 47% that are passing away from COVID-19. In Plymouth County, it's 8,583 have confirmed cases and 643 deaths. And in Plymouth, 598 cases of confirmed COVID-19 with 69 deaths. With regard to long-term care, there has been almost 5,000 deaths now at this point, 4,944 deaths. And in long-term care, the number of COVID-19 cases that included residents as well as staff were 23,089. But even that is, as Bob Eisenstein mentioned last week, is slowing down. So it's nice to see. With regard to unemployment, a little good news. There were 58,000 jobs added in the month of May. So as the reopening plan started, some people started going back to work. We hope to see that trend to continue when the June numbers come out in early July. But we are seeing people going back to work, so that's a good sign. So the unemployment rate is now at 16.3. With that, there is, as you indicated, Steve, a lot of things happening. Step 2 of phase 2 has started today, which means indoor table service as restaurants can begin today. A lot of close contact personal services can begin, such as nail salons, day spas, tattoos, body piercings, and personal training. And retail dressing rooms by appointment only can open up as well. And offices can be at 50%, although the governor is still keeping in place in order for, if you can work at home, still work at home at this point. The other news that came out the other day was the phase 3, which was scheduled to begin on the 29th of June, which is a week from today, has been now pushed back to July 6th. So that'll be bigger venues such as gyms and movie theaters. So some more time will pass before that happens. And it looks like child care centers will be on task to open up or start opening up a week from today, it looks like. But that could change as well. We're just not sure yet. So so a lot more is happening. Things are opening up and the numbers are going down, which is exactly what we wanted to see happening. So, people just need to continue doing the social distancing and wearing the mask and the proper hand washing and we'll continue to open more and more. So that is the update for today, Steve.
Thank you, Plymouth State Representative Matthew Muratore. He's here to answer your questions. And at this time, I'd like to announce that on Thursday, we'll be having another update. We'll be joined by Dr. Philip Triffletti. He's an attending care physician at Beth Israel Deaconess. Also, Dr. Mark Wilson. He's the Plymouth epidemiologist. Christopher Smalley. He is Director of Marketing and Communications, Beth Israel Deaconess in Plymouth. Also, Gary Maestas, Superintendent, Plymouth Public Schools. We're talking about the close of this current school year and the plans for opening for the next school year. Robert Eisenstein, a senior living consultant, and also Stephen Cole, Executive Director, Plymouth Regional Economic Development Foundation. Each day, our panel listens to each other as they give their updates, and then we proceed with a closing statement from each of the panelists. And so today we're going to begin with Sarah Cloud. Sarah, what would be a takeaway from today's update that you would like our viewers to remember? Sarah?
Hi, I'd like to, I think the takeaway is to understand that we're all doing the best we can during the pandemic, and there's no judgment in kind of how we've managed to get through this, but that there's times where we need to take steps to help ourselves and to be healthier, and that there's help and hope available. And you were very, very fortunate to have a couple of options available to us. Part of engaging in help is showing up to a meeting, to an AA meeting, or family showing up to a support meeting. The hardest part, I think, is that first time. And now that we're in the pandemic and everything has gone virtual, that makes it a lot easier and a lot less intimidating. So I'd really encourage people to explore possibilities. It's not a full commitment to either explore a meeting online or and take a look at what's maybe available at the Massachusetts Helpline website. I also want to, the really nice weather that we have, a lot of people may not be aware that we're very fortunate to have a chapter of the Boston Bulldog Running Club here in Plymouth. This upcoming fall, it will be a full 4 years. And what the Boston Bulldog Running Club is, it's a wellness community. It's certainly for folks who want to run, but you also can walk. All paces are welcome. And it's for folks who either considering recovery, are in recovery, family members, and treatment providers. So we have a really strong chapter here in the Plymouth area that meet at Nelson Park. And so very proud of to be the second chapter in the state of Massachusetts. And now we're actually in Chicago as well. So, try exploring some new things and new possibilities. There's many, many pathways to recovery. And they're very unique to everyone's individual preferences and needs. So just kind of go out there and explore what's available to you and get the help you need. Thank you.
Thank you, Sarah Cloud, Director of Behavioral Health and Social Work, Beth Israel Deaconess in Plymouth. We're now going to go to Plymouth State Representative Matthew Muratore. Matt, a viewer asks, have the outbreaks in other states affected Governor Baker's plans in Massachusetts?
No, I don't think so. No, it's not. I think this has been the plan all along. I think that the delay from June 29th to July 6th for phase 3, I think more has to do with the July 4th weekend and the July 4th week, which is really a heavy weekend of people on vacation, coming away, et cetera. And I think he wants to try to avoid some of the, the movie theaters and some of the larger venues for that. I think there's a concern, though, with other states and what's happening in other states, bringing it here to Massachusetts. But, we can't really control that so much other than when people do come here to ensure they continue the physical distancing and the wearing the mask and the proper hygiene. So I would say it's not making his decisions any different. It's looking at our numbers here and how it's going. And again, the big push will be now up to over 30,000 tests per day by July 1st, and then 45,000 by the end of the year. So it's all going to be about testing and tracing, and that's the course we're going to continue with.
Thank you, Plymouth State Representative Matthew Muratore. I'd also like to just give an update on Plymouth's town meeting. It is going to come to you as a virtual town meeting by a video conference platform on August 10th. Meanwhile, as Select Board Chair Ken Tavares mentioned, with the election having occurred on Saturday, we also had a number of town meeting members either re-elected or new members elected. We're hoping that this week many of them will go to be sworn in with the town clerk's office in order that they may fully participate in all of the upcoming gatherings that are going to occur. There are precinct caucuses that are being scheduled in order to organize the precincts. There's also a committee of precinct chairs meeting that is scheduled for this Thursday evening for the committee of precinct chairs. And we are going to begin training in the month of July. The first training session that has been scheduled is Thursday, July 9th at 7 p.m., and that is with the committee of precinct chairs. The following week, we will have training in each of the precincts. There'll be multiple trainings each evening Nicole Manfredi, the assistant town moderator, will be the lead person who is organizing the training, and she is working closely not only with me, but with Julie Thompson and her crew at PAC TV, as well as with Dr. Gary Maestas, the superintendent of Plymouth Public Schools, and Joseph Young, who is the person who is leading technology for the town of Plymouth. There'll be more to come with Plymouth's town meeting. At this time, we're going to go back to Michael Jackman. He is the district director for Congressman Bill Keating's office. And Mike, what would be a closing statement that you would have on behalf of the congressman?
Yeah, thank you, Steve. Just to follow up on Rep. Muratore, the response about what's happening in other states, I think we should really be proud of what we're doing here in Plymouth and here in Massachusetts to flatten the curve. I mean, it hasn't come without some pain, and obviously there's some economic pain for folks who run businesses or have lost employment. But in terms of the healthcare and the outcomes from what the measures we took, we should be really proud of what we've done and look at the numbers, and not to compare ourselves to other states, but know that the decisions that were made and the adherence to those decisions has had an impact and has saved lives, quite frankly. So I think that's important to note as we go on and as we continue to work through the restrictions and sort of the new normal, whatever the catchphrase is going to be. But I think it's so important to just keep that in mind going forward, because we have had an impact and we need to continue to have that impact to keep the curve as flat or descending as possible. Just knowing that there's only so much we can do to control the virus, and if we all do our part, we can have a part of the effort to control that. Just want to mention, as I normally do, the census. 2020 is a census year, despite the pandemic, despite everything that's going on. The census is still being conducted. Folks should have received something in the mail, or if you have a post office box and you don't receive mail at your home, you should have received what they call an update leave package. It's a little door hanger that you should have gotten on your front door with information about how you can respond directly to the census, and how the census will use that information to update their records. So please do respond. 2020census.gov is the website to go on to find out more information about how you can respond to the census. The more people that self-respond through the website, through phone calls, the fewer people are going to have to knock on doors. And during this pandemic, we want to obviously keep that as minimal as possible. So thank you, and just keep on doing what everyone's doing. And it's great to be on these calls and hear all the wonderful things. This is my second call with Sarah today. So I know a lot of the great stuff she's working on, but it's always great to hear it and have other people have the chance to hear about all the wonderful resources that are available too. So thank you to everyone on the call. Thank you to everyone at home for all you're doing.
Thank you, Michael Jackman, District Director, Congressman Bill Keating's office. Heather Cozby, our Plymouth CPA, you've given us a lot of information about the programs that are available to people. What would be a good takeaway for today's update?
So I think, thank you, and I appreciate being here so much. The good thing is that, you got to you got to get all the information again. So if you're a small business, you're involved in these loans, keep going to SBA.gov, keep looking at the date of whatever you printed versus what's on the website, and then just toss away what you have, print the new one, and keep moving forward. The good thing is with this law, you have more time. Now, you don't have to wait 24 weeks to finish your loan application. If you've done everything, you've got your numbers, you've got your support, and that application now, the instructions, it gives you all the information you need of what you have to submit. So, get it over with and submit it to your bank. If you're a small business, you really need to be working with probably your accountant and your banker to get this wrapped up. Mindfully, your accountant's July 15th deadline is like their April 15th deadline. So we're all a little crazy right now. So I would say if you're a business, you don't need to do anything before July 15th. Give your accountant a break. It'd be much appreciated. And thank you to all my patient clients who have been waiting for me to work on their stuff. So just continue to educate yourself and continue to follow what's going on, because there are a lot of changes still coming, and it's just never ending. I can't wait to never say the letters PPP again in my life. That's where I'm at. So thank you.
Thank you, Heather Cozby. She is the Plymouth CPA who's been joining our Monday updates. We'll be back again next Monday as well with Heather and with Michelle Bratti, Director of Elder Affairs, Town of Plymouth. Michelle, what would be a closing statement today for those people that you're serving?
Sure. Hi, Steve. Thanks again. And thank you to PAC TV and my fellow panelists as always. It's always a pleasure being here. I think for seniors in this community, with the social distancing and where we are, I just want to say we see you. Even though we can't see you, we see you. You are important. You are relevant. The seniors in the town of Plymouth make up approximately, and don't quote me, but approximately almost a third of our community are seniors. And to Mike's point, the census counts. Wait till you see the numbers when they do come out. So you are prevalent, you are important. And even though you've had to be the group that socially distanced and stays home more than any other group, please know that you're not forgotten. Not only not forgotten, your vitality, your importance to this community, your commitment to community, the gifts that you have to offer, we know that they exist. We are going to do everything in our power to make sure that the people in this community understand that. We may not see you, but we see you. We're here for you, and we're here to learn from you. And that message will continue. Thank you.
Thank you, Michelle Bratti, Director of Elder Affairs for the Town of Plymouth. And each day we circle back to our Plymouth State Representative, Matthew Muratore, for a closing statement. Matt, what do you want our viewers to remember today? This is number 60.
Well, with Heather's comment, owning daycare centers, I like to hear PPP because that means we're open again. So I'm hoping we're going to be hearing those letters again soon. But I understand in your world, Heather, what it's doing to you. But yeah, it's great to be on with all of you, each week to hear all these updates. And as everyone has said, you want to continue to get the right information. And I feel this is the best place to get the right information that you're looking for. Continue to stay informed, by going, as I say every day, going to mass.gov /COVID-19 or mass.gov / reopening, or ask questions by calling 211. Get text alerts by texting COVID-MA to 888-777, or in Spanish, COVID-MA ESP to 888-777, or for health questions, bowie.com / mass. And just continue to do what we're supposed to be doing. Continue wearing the mask, continue the social distancing, the physical distancing, proper hygiene. Even when you're out in public, continue to do all these things. But if you don't need to go out, particularly if you're over the age of 65 and have health conditions, then please don't go out. Continue to doing what you're doing. And remember that yes, offices are now starting to open a little bit more, but if you can still work from home, continue working from home. We keep hearing about the second phase of this COVID-19 happening. If we continue doing what we're doing here in the Commonwealth, we're going to be fine. We are going to be fine. We're not going. The idea of opening slowly, the way we've been doing it, is so when we do have that second wave, that we do not have to go back to closing everything again. That's the point of all this. So let's continue doing what we're doing, and we will all get there together. And yes, thank you to PAC TV again for doing all these shows, and not just for this community, but for the other communities you're doing. It's been tremendous to get the word out there. You want to thank all the healthcare people and all the other folks who are working to keep our economic health and our physical health in check. And again, as I say every day, let's continue coming together by working together.
Thank you, Plymouth State Representative Matthew Muratore. And at my meetings with the Committee of Precinct Chairs, I've also been talking about PPPP in Plymouth because we're planning our special and annual town meeting. We're preparing for it. We're going to be doing lots of practice with training, and we ask for everybody's patience as we move forward with this new video conferencing. On Thursday, we have a lineup again that includes Dr. Philip Triffletti, Dr. Mark Wilson, Dr. Gary Maestas, Christopher Smalley, Robert Eisenstein, Stephen Cole, joining Matt Muratore and Ken. We'd like to thank everyone on the panel today. They include Sarah Cloud, Michael Jackman, Heather Cozby, Michelle Bratti, and we now circle back to the chair of the Plymouth Select Board, Ken Tavares. Ken, what do you have for us today?
Well, my takeaway today is that there's a great deal of optimism. 3 months ago, I think as we were beginning this journey, it was frightening. But today, especially with the panel that we have, you can hear the good things are starting to come about, knowingly that we have to be very, very cautious and not give up, as Matt has talked about, washing of hands, distancing, everything that has kept us from trouble. So I'm optimistic about it. Since this started, I keep a daily log of things that have to be done, and today I'm happy to report that usually by noontime I'm on the second page, and today it's barely one filled up. So I can start to see things taking place and being done properly, so that there aren't as many questions or concerns. We're not giving up. We're going to certainly continue doing what we've been doing because it proves that it works. Thank you.
Thank you, and that is Kenneth Tavares. He is the chair of the Plymouth Select Board. I'd like to thank all of you for joining us today. I'm Steve Triffletti, Plymouth Town Moderator. Please join us this Thursday and next Monday for our daily COVID-19 Plymouth update. Good day.